Hi, everyone. I'm Dr. Marzana Genius. I'm a geriatrician, and today I'll be discussing how we care for older drivers. Thanks for joining our lecture. I have no disclosures. And our agenda for today includes discussing facts and figures about older drivers. We'll talk about some risk factors for unsafe driving, how to assess older drivers, and how to manage older drivers who have driving safety concerns. And we'll end by talking a little bit about some ethical and legal issues pertaining to older drivers. So I want to start out by just thinking about and considering what driving means to us. It could mean a lot of different things to many different people, but I think a lot of common thoughts that come up in my experience, and including myself, I'm also a driver, is the fact that driving gives us a sense of independence and freedom. It also gives us a lot of control over, where we go and when. Gives us flexibility, also allows us to stay active by being able to get to places and so forth. It also means we're able to socialize, right? And meet with people in places where maybe public transportation is not available or easy. And, especially for older patients, it also can mean competence. I do hear from, a lot of older patients that, when we talk about, concerns about driving, it makes them feel like, maybe their loved ones or clinicians are telling them that they're incompetent, or they feel like if we're concerned about their driving, that they're losing their competence, which is, certainly can be a scary thought and feeling. But of course, it's not uncommon, therefore, that we see a lot of these kind of stories, like this story from last year about Dick Van Dyke, where his car keys were taken away by his wife, who was concerned about his driving. And this was actually about 10 years after his initial car crash. Thankfully, he was okay, but it seems like there may have been some indication or some red flags about driving, unsafe driving behaviors perhaps in the past. And clearly his wife had some concerns for other reasons before this happened. And some of the points that were made in the article, actually, the newspaper article, was that the wife was terrified. If she doesn't take the keys away now, it may be too late. And that, Dick was unhappy with his wife's decision. And basically his impression was that, well, I'm still just trying to have fun, and that somebody's looking after me. So, clearly the driver, who's at risk for losing his driving privilege, doesn't seem to be so worried about it, while, his wife very much concerned, which again is a very common scenario. So we know that driving has very significant benefits to our quality of life. But we also know that driving and unsafe driving can have very significant risks and complications. And let's not also forget that there are alternatives to driving, which we have to consider when we're discussing both the benefits and risks and the options with our patients. So one thing to keep in mind is that the number of older drivers in the US is growing very rapidly. Back in '95, there were about 35 million older drivers. And about 4 years ago, in 2020, there were almost 50 million older drivers, or about 1 in 5 of all drivers in the US being 65 or older than 65 years old. According to the National Safety Council, this is data from a couple of years ago, but they stated that about 8,500 drivers over the age of 65 were involved in fatal car crashes. That's a large number. And most of these traffic fatalities involving older drivers occurred during the daytime, occurred on weekdays, and involved other vehicles as well. And we also know that older drivers have a higher crash risk than middle-aged adults. And this is related to different things, including decline in mobility, cognitive function, as well as vision, related to which are age-related changes, as well as medications. Obviously, as we get older, we accumulate not only the number and complexity of medical conditions, but also, we're more likely to be on more medications, including more high-risk medications. We're at high risk or increased risk of having more interactions with medications, which can affect driving safety. So there's many different factors that go into this. According to studies done, motor vehicle accidents are also more harmful for older adults. According to this study from 2018, you can see that patients or people who are over 80 years old are a much higher risk for mortality and complications. So why are car accidents more harmful for older adults? Well, again, several different reasons. As we get older, our reserves to manage stress and injury decline. We're at increased risk for fragility for reasons like osteoporosis, atherosclerosis, which is more prevalent in older patients. And older patients are also more likely to use older cars, which lack safety features, which may be helpful to prevent crashes and keep people safer if they do get into a car accident. So, should there be an age limit on driving? And if there should be, where would we draw the line, or where should we draw the line? There's really no consensus about this, because we also know that age alone does not determine driving performance. Certainly, there's patients who are younger, who are much more unsafe drivers than older patients. And there's older patients, who may be less safe. So there's really no easy way to determine just based on age who is a safe or unsafe driver. Currently, in about 37 states and the District of Columbia, there are special provisions for more mature drivers. Some of these provisions include things like increased frequency for requirements to renew a license. Some states require vision tests or road tests. Some states don't allow older drivers to renew things online or by mail. So different states have different requirements. In Washington, D.C., for example, individuals 70 or older must produce documentation from their physician certifying their physical and mental competence to drive. Individuals 75 and older must take written and road tests every 4 years. Certain states have a law, for example, that prohibits licensing administrators from age discrimination. And some people feel that you can be too young to drive, but you can't be too old. But others may disagree. So overall, there's really no general restrictions, at least not on the national level. And a lot of times, people and patients and clinicians are left to just kind of, or patients rather, are left to self-regulation. But what's the problem with self-regulation? Well, it's, you know, a lot of people, unfortunately, who are driving and with unsafe driving behaviors continue to do so because they may not really see a problem with them driving. They may not notice their unsafe driving behaviors. And they think they're just, perfectly fine. Some of them, even when they do have, concerns about their own driving, they don't want to impose, an extra burden on their, family or friends or neighbors to drive them places. So they continue to drive. Some just, even when they are concerned, they say, well, I've never actually gotten into an accident, so I guess I drive safely enough, so I should continue. Again, this is not it's not an easy thing for patients who have unsafe driving behavior to agree that there may be a problem and perhaps they should, consult specialists or professionals for help to make either their driving safer or to give up driving. So this is also not an uncommon situation, right? When people either notice or they may not even do this consciously, if they have, trouble whether navigating directions or have poor vision, some just naturally compensate by having, a co-pilot. Again, either to be their GPS or to help with, seeing road signs. Again, it's just compensation for driving impairments, but it's really not the safest situation. And actually, there was a study done by surveying about 500 people that 65 years and older, who actually, and 24% of those people reported regularly using passenger guidance or co-piloting. So how can we identify potentially unsafe driving behaviors? Well, our first and I think common source for us to have suspicion that maybe we need to evaluate our patients further are caregiver concerns. The New York State Office for the Aging has actually done surveys and research on caregivers who are concerned about driving of their loved ones. And they found that 70% of caregivers had been concerned for a year or more that their older relative was not driving safely. And the safety problems most often that were reported by the caregivers were slow reaction, slow driving, and inattention to road hazards. They also found that over 75% of the caregivers surveyed felt that their older driver had a medical condition which impaired their ability to drive safely, either vision, hearing, or restricted movements were some of the concerns reported. And over 60% felt that there was a recent medical event associated with the decline in driving. Considering that, 60% of those caregivers also reported that they were unable to discuss the problem with the driver. And 70% of the caregivers suggested that they need help from their physician to either discuss the driving concern or to tell them not to drive or to report the driver to Department of Motor Vehicles. So what can we do as clinicians to lower the risk and prevent driving disability in our patients, and also lower the risk of accidents and injury, not just of our patients, but also of our communities as well, right? So there's primary prevention, where we assess and intervene to prevent the loss of driving ability. There's secondary prevention measures that we can utilize to address issues that have already caused the loss of driving skills, and attempt to restore those skills through treatment and rehabilitation. And there's tertiary prevention, which focuses on identifying when irreversible loss of driving skills has occurred. And of course involves, discussion of alternatives and so forth. So the initial thing that we can do to screen patients are just things that we can do just by observing the patient, including noticing whether there's any decline in their personal care, if they have any difficulty walking or getting in and out of the chair, so difficulty with mobility or ambulation, if they have any difficulty with visual tasks, if their attention, memory is impaired, or language, expression, or comprehension. Other red flags we can gather from history, from the patient or from the caregiver, whether about history of getting lost. It's not unusual that, when you ask specific questions, whether there's been any changes in driving or getting lost, perhaps a family member might mention, grandma or mom or dad has been driving to visit me for a long time, but just recently they forgot the directions and had to call me to help them with navigation and getting to my home. That could be a red flag, an initial red flag that there may be some more digging that we need to do, and evaluation in order to determine whether it's safe for this person to drive. Also, if caregivers sometimes express that increased anger or frustration while driving, or near accidents happening, even if there is no actual accidents, or even just increase in tickets, whether for speeding or or warnings even given, that may be a red flag. Other red flags, just reviewing a patient's chart, for example, or during the visit, can be the medication list, basically, just to review for high-risk medications which can impair someone's driving abilities, commonly benzodiazepines or other sedative medications, anticholinergic drugs, muscle relaxants, but many other medications can affect driving ability, and some of them are on this list, including hypertensives, seizure medications, and so forth. And a physical exam also is very, very important. You want to look for gait, balance problems, speed, dexterity, visual acuity, and visual field testing is also very helpful. Strength and range of motion is helpful to see, particularly in the ankles or neck, to see if they're able to turn, and noting any change in muscle tone or tremors. It may be helpful. Slow responses to visual or auditory cues, as well as problems with reflexes. Driving ability also can be evaluated either by family. Sometimes I ask, when a family member is present or caregiver, when was the last time you drove with the patient? And if they've noticed any unsafe driving behaviors. And if they haven't, and it's appropriate, sometimes we suggest maybe doing that. Or sometimes we even refer patients for formal driving evaluations. Either way, it's helpful sometimes just to see if the patient is perhaps not following stop signs or traffic lights, or if they have trouble turning the wheel and making turns. Some of these things you won't really know unless you actually see the person having difficulty with things. Cognitive ability is also important to evaluate and assess, including, memory loss, obviously decreased or impaired wayfinding, attention, inability to recognize unsafe situations, and also just, basic knowing the date and names can be a red flag or indication that the person may be an unsafe driver. Trail making tests have actually been shown to be a predictor of car crashes. In this study done in North Carolina, people who scored in the lowest 10% on this test had 1.5 times more crashes. They also found that patients who completed Trails B who it took longer to complete the Trails B test were about 2 times more likely to crash. Clock drawing test, when compared to the mini mental status exam or trail making test, was found to be the best predictor for pedal errors as well. So consider doing a clock drawing test as well in your evaluation. Motor evaluation is also important. Some things to consider is doing a rapid pace walk, a manual test of strength, as well as testing range of motion in the neck, in the head joints, and other joints. This is just a review of the rapid pace walk. Get up and go test, also helpful, as well as functional strength and range of motion testing. The American Geriatric Society has a very helpful and useful guide for clinicians to assess and counsel older drivers. I do recommend reviewing this resource. I think it's a really helpful tool, including how to screen, how to evaluate, and also helps with management. So if you haven't already, I definitely recommend looking into this. So what else can we do to help our patients drive safely and avoid disability and avoid injury and accidents? We can also help by treating other underlying medical problems. Obviously, if other medical conditions are uncontrolled, even if they're great drivers, that can affect their driving safety. Referring patients to an ophthalmologist for regular eye exams and vision exams. Referring to physical or occupational therapy can be helpful. Sometimes referring them to driver rehabilitation specialists can be helpful to maintain safe driving, or maybe get some recommendations how to augment driving to drive safer. So older driver rehabilitation is very useful for some patients. It does take time. I would say the most common barrier is the cost associated with this, but certainly there are ways that this can be covered. So definitely still a great option for patients to consider. I did want to mention that patients with dementia, because this comes up a lot, it is possible that patients who have dementia can still drive safely. So this is just something to keep in mind, because someone who has a diagnosis of dementia doesn't necessarily have to stop driving right away, at least in the early stages of the disease. Patients with Alzheimer's may be able to continue driving for several years, even after diagnosis is made. So again, just like age is not alone is not a factor to recommend stopping driving, neither is dementia diagnosis. So I think there's more evaluation that needs to be done to determine whether patients should continue to drive or not, or if it's safe for them to do so, even when they have that diagnosis. This is a study done where basically that showed that Alzheimer's patients with mild cognitive changes have similar crash rates to those that were in the study as controls. So again, just remember that patients with a mild cognitive impairment, or sometimes even mild dementia, can still drive safely. So that's just something to keep in mind, and as you're evaluating patients. And there really is no definitive or standardized test that we can do to pinpoint when driving should be stopped. So, sometimes when there are concerns, but we don't really have maybe solid evidence, or we're not sure if it's safe or not, and the patient really insists on driving, maybe we can offer as a compromise to maybe limit driving or restricted driving to driving during the day only, even though obviously that doesn't prevent or guarantee, safe driving, but it may limit, more unsafe situations like driving in poor lighting. Recommendation to avoid driving in bad weather also can be helpful. Maybe recommending only driving in specified areas that are familiar to the person. Using a navigation system also can be helpful for patients, so that to lower the risk of getting lost. And also, it does happen, not uncommon, that some drivers just give up driving on their own without, a challenging conversation. But I would say more often than not, most people don't want to give up driving unless there's really, significant discussion and reason for them to do so. In a national survey of 467 geriatricians, it was found that over 75% agree that physicians are responsible for reporting patients who have unsafe driving. and more than 86% would contact state authorities despite the objections of the patient. And 73% would even report despite the objections of the family. Now, it's always a challenging situation when patients wish to continue to drive, but the family requests that the physician intervenes to persuade the patient to give up driving. According to this focus group that was done, this was a while ago, but they noted that while family advice had limited influence on the participants, most agreed that if their physicians advised them to stop and their family concurred, they would certainly retire from driving. So how do we have these challenging conversations with patients, especially when they're not aware of safety concerns related to their driving? Something to consider starting off with is just beginning with the older adult's perspective or perception. You really want to understand, what their view is and what their thoughts are about driving. Are there concerns that they are not aware of, or are they aware of the concerns and just feel that the benefit of driving outweighs the risks, all the alternatives? You also want to assess the family and the caregiver's readiness to stop driving. It's again not uncommon where perhaps we see patients who drive and other people are dependent on them for transportation as well, whether it's the spouse or someone else. So the patient losing their driving ability may affect not just them, but other people around them. It's also helpful when you're counseling to utilize other clinical team members. So it's not just coming from one person. Often in my practice, I share this discussion, or I involve our social worker to help with these discussions. We discuss the importance of driving cessation when we feel a patient really should stop driving. And we discuss and explore options to consider to make sure the patient has alternatives for transportation and doesn't feel like they're losing, everything by losing their ability to drive. But we give them options for still how to get around and go where they need to go without having to drive on their own. So that's, I think, very important, at least if they feel that, even though their quality of life and flexibility and independence might be affected, but as long as they, feel that there are other options for them to get to places, they will maybe more willing to consider. And many people are just not aware of the resources or all the alternatives to driving. So I think, exploring the options for transportation alternatives is very helpful. A lot of patients also may not want to give up driving because they don't want to be a burden on the family. So, definitely supporting the family and the patients through this process is very important and helpful. Sometimes just even, having the family discuss with the driver, that it's really not as much of a burden as they feel it would be to provide transportation for them when they're unable to drive. But sometimes when the driver is not able to understand the gravity of the safety issues and insist on driving, sometimes, let's say, if they have, cognitive impairment, let's say, and they're not able to understand the safety risks. Sometimes the family has to, kind of put their foot down and work with, the rest of the clinical team to ensure that the patient is safe and other people are safe by stopping them from driving, even when they insist to do so. The National Highway Safety Traffic Administration also is a great resource for patients, for caregivers, and medical professionals as well, for information on safe driving, and including in older adults. They have videos on how aging and medical conditions can affect driving. They also offer resources to learn and get guidance on how to assess and discuss older driver safety issues. And they also give options for transportation. So I do recommend accessing this resource as well for additional information. And of course, there's ethical and legal issues related to older drivers. For example, laws, regulations, and policies vary not only by state, but by local jurisdiction, and are also, of course, subject to change. Certain states have mandatory reporting requirements, but for example, here in New York, we are not mandated to report unsafe drivers. But at the same time, as clinicians, we also have the ethical responsibility to patient confidentiality and public safety. So very, very important to obtain patient permission before contacting caregivers when we have concerns and documenting that in the chart. And also to have the proper consents. For example, when we're considering reporting unsafe drivers to the Department of Motor Vehicles. So again, consult your local, jurisdiction and laws about, the rules in your area. So that's what I have on this topic, and thank you so much for listening. And I'm also happy to answer any questions if you have any. Feel free to email me or contact me anytime. Thank you for listening.